Thank you, everyone, for joining us tonight. Tonight is February 16th, 2017. Welcome to the nutraMetrix National Conference Call. Our topic this evening is heart health and the significance for your practice. My name is Brandi Murphy. I'm the Director of Training and Sales for nutraMetrix, and I thank you for taking the time to join us tonight to learn about how you can incorporate some heart health programs through nutraMetrix into your practice. Before we get started, I'd like to talk to you about the mission of nutraMetrix. You see, we believe patients should have access to healthy lifestyle information from their trusted health professionals. And this is why everything we do is focused on helping our health professionals implement customized wellness solutions that benefit both the patients and the practice. By providing health professionals with science-based nutritional interventions, revolutionary technology such as our GeneSNP DNA screening analysis, wellness education programs for the patients, and trained nutraMetrix consultants, we believe we're changing healthcare one patient and one practice at a time. We would love to help you with implementing nutraMetrix into your practice. So we're here tonight to help you learn about some of our products and some of our programs. And joining me tonight, I have Dr. Deedra Mason, who's our Director of Clinical Research and Education. Dr. Mason, can you please say hello?
Hello, everyone, and thank you, Brandi, for inviting me to talk about Heart Health Month and some of the supplements that can support patients like mine and for the practitioners across the United States.
You know, it's such an important topic because heart disease, as you know, is the leading cause of death for both men and women in the United States. In fact, 1 in 4 deaths are caused by heart disease. But the good news is that it is preventable and that patients can significantly lower their risk with lifestyle and dietary changes. The average health practitioner does give standard advice such as watch your weight or control your cholesterol, and they know patients need to get healthy, but the question is how? And do physicians have measurable action items for their patient base? Are these changes patients are able and willing to stick to? So let's go ahead and I'm going to ask you some questions if that's okay, Dr. Mason. We'll kind of do this as an interview. Let's talk about what the American Journal of Clinical Nutrition talks about. They talk about the effects of omega-3 fish oil supplementation and how it was shown to be beneficial for healthy cognitive and cardiac functioning. The studies that they talk about show that supplementing with fish oil daily can rapidly rise the levels of EPA and DHA in cardiac tissue. I think this is important, as I believe you do as well, because both EPA and DHA have been proven to help maintain normal plasma triglyceride levels. In addition, DHA has been shown to help maintain blood pressure and blood viscosity. The study also showed an inverse relationship between EPA, DHA, and arachidonic acid, an omega-6 fatty acid. As EPA and DHA increased in heart tissue, phospholipids and arachidonic acid decreased. How much EPA and DHA do you feel that patients need, Dr. Mason, and what else is important as you look towards targeting supplementation to mitigate risk?
Well, one of the things I think is important, and you got into it in that idea of cardiovascular disease or risk factors for heart disease, familial, genetic, or otherwise, have this very strong component of inflammation. And so while you're right that they can be modified by lifestyle is really the trigger here or the tipping point. So when we talk about how much fish oil is necessary, we need to be, one, specifically educating our patients about that we need to be choosing EPA and DHA as true fish oils, because many of our patients understand omega-3 fatty acids but may not be getting the best sources of this heart-friendly omega-3 in the form of EPA and DHA. So at a minimum, we want to make sure that we're recommending no less than 1.5 grams of EPA and DHA to people that are already healthy. But if inflammation is one of the primary risk factors, family or genetic risk factors for heart disease are also a component of our patient presentation. If we add on to that insult things like comorbidities such as obesity, poor sleep habits, or a sedentary lifestyle, then we're going to have to talk to our patients about having a higher commitment to supplementation. Now, you did ask about the idea of biomarkers. Are there ways that we can measure the health of our patients? And we can do that very easily and set the tone in a kind of test, don't guess manner with our patients, where they're able to see that not just their lipids may improve, but their triglycerides, will improve with the use of omega-3 fatty acids. It goes beyond the cardiovascular benefits, though, Brandi, because other things that we can talk to our patients about to motivate them to stay consistent with diet, lifestyle, and supplementation, like EPA and DHA, of course, is that we should also expect that as their risk factors for heart disease go down, that some of those triggers, like inflammation, will also start to subside. So they can expect better physical mobility, less joint discomfort, more energy. And these are just some of the ways that if we were to educate our patients about the importance of diet, lifestyle, including supplementation, we could improve more than just their cardiovascular health.
You know, I love that you pointed out the fact that dosage or the amount of EPA and DHA that they take makes an impact. Because when you go to the health food store, if you go to a vitamin store and you pick up many of the products that are on the market, some of them have such small levels of EPA and DHA in them that many patients don't realize that in order to get the amount of effective ingredients they would need to take 5 or 7 capsules of those fish oils that are commonly found in the marketplace. So thank you for pointing that out, that you need to take a minimum of 1.5 to 3 grams depending on their current health status.
Right, and I do think it's important for me as a practitioner or people, or for people that are involved in community health, that they can be a voice for people that are looking for more information, that they do understand that what's available outside of a professional channel or without the supervision of their healthcare provider may be inadequate to meet their needs. It is necessary to have this open conversation with practitioners, and practitioners on the other side with their patients about how or what it is that we can do to stay healthy in between office visits. And that does require not just a commitment to regular office visits or an open dialogue, but following up on these recommendations in between those office visits. And that's why omega-3 fatty acids, I believe, have reached the traction that they have in the wellness and personalized medicine industry, because they don't only help for a number of maladies, but they are also well respected in the literature and by a diversity of practitioners as being something that's going to produce results.
You know, it's so important as we age, we start to break down. Really, we experience a lot of wear and tear, not just in our cardiovascular system when we think of, for example, just our heart tissue, but how does our overall aging and wear and tear impact cardiovascular health as a whole? Not just the cardiac tissue, but the circulatory system is so, so connected to that. What are some of the nutrients that you would recommend that patients supplement with for overall cardiovascular health?
Well, again, this is where we move from the omega-3 fatty acids and understand that while omegas are considered cardioprotective and definitely protective of those blood vessels like you're talking about, still that heart, that muscle is having to work 24 hours a day, 7 days a week. It's contracting for 50% of the time and needing, of course, to relax for the other 50%, and to keep that dynamic tone is very energy demanding. And so one of the ways that we can keep not just cardiac muscle, but all of our muscles more dynamic and truly more efficient as we age is by making sure that we're feeding energy, the respiratory chain in the body, that we're feeding the way our body makes energy. I like to refer to the cells that do this as our battery packs. They're called the mitochondria, and they're fed by coenzyme Q10. And as we age, coenzyme Q10 levels or storage in our tissues starts to decline. And I think many of our patients would be surprised to find out that this decline happens as early as the 30th year of life and starts to go down precipitously with each decade. And so by the time we're in later decades of life, in our later 60s, 70s, and beyond, we can be quite compromised if we haven't much earlier on thought about what we're going to do to replete the mitochondria and energy stores in the body with things like coenzyme Q10 and then foods that are dense in coenzyme Q10. It may surprise many people to know that coenzyme Q10 being very dense in flesh tissues or meat and milk animal products is something that, while those are the most dense food products for coenzyme Q10, Brandi, these are also many of the foods that individuals that are looking to support cardiac health may start to avoid at the discretion of a nutritionist, a dietitian, or even their cardiologist or primary care physician. They may move away from dairy products and meat because of their pro-inflammatory nature, but we want to appreciate that they will also be missing out on some of the best resources for coenzyme Q10, making supplementation all the more necessary. It truly is a balance between healthy dietary choices, lifestyle factors like sleep and exercise, and then identifying places where there may be a gap and so you need to supplement. And I think that for that cardiovascular diet, supplementation with coenzyme Q10 is absolutely essential. I want to bring up another point, though, about the importance of coenzyme Q10. It is not just a benefit for cardiovascular health or for energy metabolism through all of the muscles in our body. As I said, not just the cardiac muscle, but we should also know that coenzyme Q10, because it is one of these energy factors, has been shown to be beneficial in immunity, has been shown to be beneficial in mental health as well. So I want people to think about anywhere where muscles or tissues where there's a lot of or high metabolic demand. That's where coenzyme Q10 is going to be beneficial. And so we're going to see that need or that requirement in the body increase as we age. And so we want to think about supplementing to make sure that we have that youthful vigor and vitality.
Thank you for that. One of the things you brought up in that last answer was how important it is to pay attention to what we're eating. And so many times patients go into a practice with not only cardiovascular concerns, but many of them are dealing with being overweight and obesity concerns. And sometimes the patients go to a practitioner and say, what can I do to get healthy? What should I be eating? Or how can I lose weight? And sadly, a lot of the practitioners don't really have an answer for them. They'll just say something like eat less, exercise more, which we all know is an age-old statement that isn't positively impacting the patients from what they're eating. We know that we need to educate them more about living a healthy lifestyle. And although the supplementation is important, what the patient consumes on a daily basis, what they eat or what they don't eat, also makes a big difference. For those of them with concerns with cardiovascular health, what dietary recommendations do you recommend that practitioners follow? And why is it important for health professionals to consider if they're looking to bring a weight management program in-house? What should they be looking at?
Well, I think that no matter what, when we look at weight management, we want to make sure that it's something that our patients can adhere to. And there's this idea in medicine of compliance and adherence. And compliance is when my patients do what I tell them to do. But when I'm not there, they're not necessarily going to follow those directions. Or when they're left to their own devices, they may not follow those directions. Adherence is when a patient, regardless of how long it's been since my instruction, can still follow those directions. And that means that we want to choose weight management or dietary programs that patients find that it is easy to follow. And that means that it's not hard for them to go out to eat or be social, Brandi. It means that it has to be something where they can reasonably assemble a healthy diet for their needs that their family can eat as well. And then, of course, as practitioners, as well as patients wanting to see results, are looking for something that has the scientific strength behind it. It's not a fad diet or something that is not sustainable. We want to make sure that we're looking at choosing food in its natural state, where we're getting a balance of healthy fats, where we're getting a balance of good proteins in sufficient amounts to meet our patients' need, both gender and physical activity. And that when they look at choosing food for its sweet factor, that we are able to share with them the fruits and vegetables that have a higher fiber content, but still have the flavor that they're looking for on their plate. A way to kind of balance that plate where we're able to take the neutral foods, things like the grains, the rices, the neutral colored foods, and make those back to side dishes instead of being the whole entree. And it's that type of education about what many practitioners have found to be wildly successful in their practices, which is low glycemic eating practices. It is food based on nature, or choosing food the way it is made in nature, balancing a diet, educating our patients about how to combine these foods properly to meet their macronutrient demand for fat, protein, and carbohydrate. But because we're able to, through programs like TLS, through weight management solutions that have that have been enriched through community, much of that we're seeing today with patients on through social media. Practitioners are engaging their patients more through some of these media types. We're able to keep our patients very adherent to weight management programs. They're easy to use. They're not foods that are unique or packaged where the rest of the family wouldn't be able to choose them or enjoy them. Low glycemic impact eating, because we're educating patients how to eat and what food choices to make. Do not have trouble going out to friends' houses, being social, or eating in restaurants, because at the end of the day, we're teaching people how to eat food based on their dietary requirements, their energy requirements, and choose foods in their natural source to be eaten, seasoned properly without additives and chemicals and the like, because they're not coming out of a box. And I do believe, as a practitioner that has been successful teaching people about weight loss, that's really been the key factor in their adherence to a weight management program, is ease of use, something that doesn't interfere with their social life and that they can utilize for their entire family. And that just means, Brandi, better health for their family as well. This isn't something, when we talk to our patients about better lifestyle habits, it's not something that we only want the patient to do. We want them to engage their family towards better health as well.
That's great. And I know if you're listening and you're not familiar with the weight loss program that we offer through nutraMetrix, we do offer a customizable weight loss program called TLS Weight Loss Solution. We have a version of it called TLS Select as well, where as a practitioner, you can wrap some of your own services and areas of expertise into it as well. But you might want to check with your nutraMetrix consultant for more information on that. I know we focus primarily tonight on heart health topics, and obesity and heart and cardiovascular disease are very much tied hand in hand, but you may want to talk to your nutraMetrix consultant for more information about our TLS weight loss solution and how that could benefit your patient's cardiovascular health as well. And then moving on, Dr. Mason, let's talk a little bit about some of the excuses that patients give as to why maybe they might be overweight or why they might not be eating healthy. And sometimes they'll just say, well, cardiovascular disease just runs in my family. You know, they kind of feel like they're they're prisoner to their genes, so to speak. You know, they say it just runs in my family, so no matter what I do, I can't change it. How true is that statement? And can you speak to some genetic factors in terms of cardiovascular health?
You bet. You know, it is a very common response to get from patients that have struggled to lose weight or have struggled to get to goal with their blood pressure or their total cholesterol. When we think about adding age onto that, and very often hormonal disruption or hormonal imbalance as both men and women age, we start to see this be a significant impediment to their health. It feels like there's a lot being piled on at one time, and we do end up getting that excuse that it's something that just runs in my family, that this is something I can expect because this is the way my parents aged. And for that reason, I want practitioners as well as patients to know that there are other solutions to identify unique points of intervention. Through nutrigenomic analysis, we're able to identify different gene variations, also referred to as polymorphisms, that show why an individual may be prone to extra weight, even where they carry that extra weight, how responsive they'll be to physical exercise, whether that exercise should be strength or endurance training, if they were bred for power or if they were bred for speed. In addition to that, nutrigenomic analysis can go much deeper than the regular dietary advice that practitioners give, much as you mentioned earlier, eat less and exercise more. It's frankly far more complicated than that, and even more complicated than just identifying some obesity risk factors. There are risk factors for anxiety. There are risk factors for sleep disturbances, and these two things play a significant role in an individual's risk factor for obesity. The individual that does not sleep well will gain weight, and this will become significantly more difficult to deal with as they age. As you mentioned earlier, metabolism starts to slow down, storage of coenzyme Q10 and even production of coenzyme Q10 starts to diminish, and our ability to be thermogenic will diminish along with that. So what we want to be able to let our patients know is through nutrigenomic analysis, not only could we look for unique or individual risk factors for obesity, but also identify other factors like sleep habits, inflammation, poor detoxification pathways that are also putting that patient at a unique risk for gaining weight as they age. The blessing here is through the nutrigenomic kind of marathon that many practitioners and scientists have been running over the last 15 years by sharing commercial genomic analysis with their patients, is that we've learned a lot in the last 15 years about nutrigenomics. We've been able to really streamline approaches with nutrigenomic or personalized medicine analyses. By doing that, we have a better idea today than we did decades ago about how a gene will behave based on the amount of nutrients that the gene environment is exposed to, the type of nutrients or the form of nutrients that the gene is exposed to, or that gene environment that is created by nutrients, as well as the amount of nutrients that we need to recommend to change gene behavior. I think one of the more exciting things that we're seeing, whether it be cardiovascular health, endocrine dysfunction, or simply weight management and age management, is that nutrigenomic analysis can literally lay out a patient's blueprint for what we as practitioners need to be doing or tracking with them. And that is a quite exciting place to be in medicine.
Oh, it certainly is. And we've talked about so many great topics tonight. We're really just skimming the surface. We talked about the benefits of omega-3 fish oils and coenzyme Q10 and helping the patients implement a low glycemic impact eating program and lifestyle into their life. We talked about the fact that their genes can provide a blueprint for them that can help provide a pathway for your practitioners to make recommendations based on that patient's genetic code. Let's talk a little bit more about how the practitioner can implement the program or the products into their practice. We're focusing on Heart Health Month right now, but cardiovascular disease attacks all year long. So we want to make sure that this is something that people don't just focus on in the month of February. This is a year-round problem, and we want to talk about how can practitioners address cardiovascular conditions or cardiovascular concerns with their patient year-round? What are some of the implementation strategies that you would recommend to bring up cardiovascular health to a patient?
Well, I think that you've hit the nail on the head when you talk about this idea of that this is Heart Health Month. I think some of the best and easy to reach kind of dialogue that we can have with our patients is that theme, that idea that this is going to be a focus, because that's not a foreign concept to our patients. We think about October and breast cancer awareness. And so what that does, Brandi, is open up a dialogue when you have these themed months. But as you mentioned, and it's important to understand, heart disease doesn't just attack in February. And so what we want to do is have that dialogue opened through these themed months, but then have that period with our patients where where we follow up and we track what they're doing. If it's through supplementation, we remind them at the onset that this is something that we're going to do on an ongoing basis, and that we have a plan in place to follow up on that, to track that, to see that their biomarkers or blood lipids, as an example of a biomarker, are starting to get closer to goal. We give them tangible benefits when we dialogue about the importance of supplementation and lifestyle, that there are certain things that they're going to notice as we wait to do that blood testing, so that we can keep them adherent to the program. And that may mean that they should expect more energy, and that they may have better sleep, that they may notice less joint discomfort. And when we can give those small, tangible benefits that are the day-to-day benefits as we're waiting for bigger changes in their health history or their health presentation, we're going to keep them more adherent. You know, it's interesting. Many practitioners that I work with, Brandi, will share with me that they don't feel as comfortable talking about diet and lifestyle and supplementation the way I do. And I'd say that's okay. That doesn't mean that you can't be wildly successful implementing a wellness program into the practice through nutraMetrix. You may not be the individual that dialogues with your patient the same way I do. And that's why nutraMetrix put together so many educational tools, so that if the physician or the healthcare practitioner or one of their assistant nurses or staff members in the practice isn't having the dialogue with them, where it's not a one-on-one conversation, nutraMetrix has so many great educational tools, many educational videos that talk about the benefits of magnesium, the benefits of probiotics, the benefits of vitamin D. And these can be as simple as sharing that information through a link with a patient, or something that's actually displayed in the reception area where our patients wait for us before their next office visit. By making that a dynamic area with a visual display that talks about the importance of not just heart health, but ongoing maintenance of health through supplementation, patients will start to bring it up to their practitioners. And one of the things I'm particularly proud of that's done with nutraMetrix is that those educational tools are not heavy on the supplementation, but heavy on the benefits of certain nutrients and ingredients that our patients do not get through diet alone, or do not get sufficiently through diet alone. Probably the best example of this is vitamin D. So if we can play videos, we can have marketing tools that are in our waiting room that get our patients to bring up vitamin D. Ask us that important question: do you think I need to be supplementing with vitamin D? Can we look at my vitamin D levels and see if they're adequate? And if not, what would you recommend? And that really does take much of what many practitioners are concerned about when they implement a wellness program is, how successful am I going to be bringing it up? And I said, with the right tools, your patients are going to bring it up to you. Now, I do think it's important to know that there may be a lower level of implementation, and this is where I really would ask practitioners looking at a wellness program in their practice that are concerned that it may interfere with the hours that they keep, it may be more work, and then they're prepared to invest, is to simply identify natural touch points in their practice where they're already communicating with their patients. Many practitioners already send out a newsletter. Many practitioners send out reminder cards for annual exams or special times of the year, including a patient's birthday. These are different areas where, as individuals that are interested in implementation, can take those touch points and use them to engage the patient in wellness solutions that may be available at the practice, letting them know new things that are going on through a postcard campaign, one that's already been used in the practice, so staff and practitioners already know how to get that information out to their patient base. With the newsletter, one of the neat things about nutraMetrix, as I had mentioned with those education tools, through the videos and the like. Those links can be shared. The nutraMetrix blog through our nutraMetrix web portal, a website that every practitioner with nutraMetrix gets, has great blog content on it. And that content can be shared in newsletters. And that content is something that can really edify the importance of a wellness program with simply a point and click or the direction from a staff member to their patient where to find this information if it's not being shared directly through a newsletter. I think there are a lot of powerful things that nutraMetrix has been able to use to engage the practitioner into a wellness revolution, as well as the patient into kind of organizing themselves to stay healthy with their kind of in concert with their doctor, saying, I'm going to do this with you. And I think that nutraMetrix has done a great job sharing these types of resources so that a nutrition or wellness implementation can really, truly go seamlessly in a practice, even if they haven't previously identified themselves as a wellness practice.
I agree. It's all about education. And I thank you for taking the time tonight to share your background in education with us, your thoughts and feelings about cardiovascular health and promoting it in the practice. And I just like to invite any of our practitioners who are on the line tonight, or anybody that's listening to this recording in the future, that you have access to incredible education resources through the nutraMetrix program, both through our health professional product and implementation training, through ongoing webinars that we have. If you have an account with us with nutraMetrix, through the nutraMetrix Facebook group that we have for our health professionals. So if you'd like to learn more information about any of the nutraMetrix products or services, please get back in touch with the nutraMetrix consultant or health professional that invited you on tonight's webinar and ask them for more information, and they can point you in the right direction to help you get the answers you need to create a successful nutraMetrix implementation in your practice. And with that, I think we're going to end the call for this evening. I know we've been on for quite a bit of time, and I know how busy everybody is, so we want to be able to be respectful of your time. Thank you very much for joining us. Thank you, Dr. Mason, for sharing your expertise. And we'll see everybody next month on our third Thursday national conference call. And we'll see everyone in the Facebook groups and at our live training events. Thank you very much and have a great night.
Thank you so much for the invitation.
Bye.